Bob Casey of Pennsylvania is one of the 3 senators who obtained the plan from the Department of Health and Human Services. The senator joins me now. Senator, good morning. You worked for months to get this. What was the most shocking that you believe was on the administration's list of changes?
Well, certainly, Stephanie, when you had an effort, sabotage of people's health care by the administration, premeditated actions to take away health care from people by removing protections. For the first time, we had protections in place that people could avail themselves of against the actions of insurance companies. The administration was trying to take that away, to put people at a disadvantage again, or to erect barriers in front of them in terms of getting health care. So this is sabotage. If they continue to do it, we're going to fight them, and we're going to win some of these battles. So they have a choice to make. They can either work with us to make sure that people have quality health care and have the protections against what insurance companies could do, or they can fight with us. And I'm ready to fight if they're going to continue to sabotage the Affordable Care Act and take quality coverage away from people by erecting barriers in their way.
Well, Americans could live to regret complaining about Obamacare or the Affordable Care Act. They could live to regret voting for President Trump, but they did. And we all know that executive actions come with every presidency. Doesn't President Trump and the Health and Human Services Secretary have the power to make the changes that they want to?
What they don't, Stephanie, is have the right to deny the public information about their health care, information about how to avail themselves of protections. This is the kind of sabotage that I don't think anyone anticipated from any administration. And a lot of this had its origin in a slimy political deal to line up votes from the Freedom Caucus when they couldn't persuade them by handing them a copy of their legislation. This was an inducement. This was a slimy deal to get to line up votes. It was the most crass political thing you could imagine. But in this case, it wasn't just some Washington deal where people were left out. People are hurt by this. Yes, there were 8.7 million people that signed up, which shows that people want health care coverage. But that 8.7 million could have been 9 million or higher. So this affected lots of Americans in a very pernicious way. And we're going to fight this continually. This fight is just beginning because there's more information we're trying to get right now.
Is the fight about the system, or is it about what Republicans are trying to do? Because what Americans hate is dirty politics, and they exist across the board. And Republicans working on this deal behind closed doors, as slimy as it may have been, is unfortunately the way politics works. While you're crafting your deal, you do it in private before people can blow holes in it. Isn't the issue the way our system is set up?
I just don't think people voted in 2016 for basic protections to be taken away. We could have a lot of discussions about changes we can make to the Affordable Care Act. In fact, we did that this year despite the president getting in the way at times. Lamar Alexander, a Republican, Patty Murray, a Democrat, came together with our Help Committee, and we put in place legislation to help stabilize the insurance markets. That's the kind of bipartisan health care effort. But this wasn't just a question of being partisan. This was a group of administration officials trying to take away protections from people as a way to somehow induce a political deal. We're not going to allow that to happen. And we won this round. We got the document that we were seeking. But we're just beginning to fight. This is going to be a long fight unless they want to work with us on ways we can lower cost and improve coverage. But so far, they haven't been willing to do that. And if they want to fight, we're ready to fight.
All right, Senator, thank you so much for joining me this morning. And thanks for getting that document.
Thanks, Stephanie.